Hey, Samantha.
Oh, hey, Gabby. Can you help me with this assignment?
Sure, what's it for?
It's for social studies. You had to choose a topic, and I chose healthcare. But I know nothing.
On your screen right now is the Attorney General of the state of Virginia, Ken Cuccinelli, a Republican, and Mr. Cuccinelli is responsible for leading the charge in that state's lawsuit challenging the had good news from a federal judge this week. What's it all mean for your lawsuit?
Well, we still have to wait for an order from the judge. We had a hearing this week in the summary judgment phase of the case, and so we're just now waiting the order, but it was a pretty aggressive hearing. The questioning to the federal lawyer was pretty pointed, and there, if you were only to draw from the hearing, and mind you, I have a litigation background, too much from what you see in oral argument, but the questioning was very much along the lines of our brief. For instance, he started out by questioning what boundaries are there to federal power if they can just order us to buy a product and then penalize us if we don't. And those two issues, the ability of the federal government to order us to buy a product, in this case health insurance, and their ability to penalize you dollar-wise, are the two central parts of the case.
You just heard me recount some statistics about the costs of healthcare in this country, and then the profits of the insurance companies, and the cost of healthcare compared to other countries. Why is healthcare so much more expensive in the U.S. than in the rest of the world?
Well, at its core, healthcare in America is based on profit, not based on the idea of public service. In other words, the system doesn't really have a motivation to teach people how to be healthy, to prevent disease or reverse disease or cure disease even. Instead, it sort of traps people in a system of dependence, of disease treatment or the continuation of disease. For example, we have millions of Americans on diabetes drugs, and yet new research just released this week shows that diabetes rates have doubled in the last 30 years. So clearly the system is not working. And again, that gets to the core, because it's corporate greed driving it, not any kind of motivation to really help people.
But are those motivators not present in other countries? I mean, you know, these companies are multinational companies, some of them.
Well, what's unique about the U.S. is that the U.S. has really locked up the monopolistic healthcare system.
Are a number of important elements in the new law, particularly around Medicare payment reform, that could help achieve better care at a lower cost. The challenge is, for a lot of the reasons that Bob discussed, these are not automatic.
There will be a lot of discussion today about the politics of all this, about who won and who lost. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country, whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Insurance companies can no longer impose lifetime limits on the amount of care you receive. They can no longer discriminate against children with pre-existing conditions. They can no longer drop your coverage if you get sick. They can no longer jack up your premiums without reason. They are required to provide free preventive care like checkups and mammograms. Young adults under the age of 26 are able to stay on their parents' health care plans. Seniors receive a discount on their prescription drugs. And by this August, nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your health care. All of this is happening because of the Affordable Care Act. Today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.
Jewel beat. Jewel beat.
No problem. There, now you know a little bit more about healthcare. Do you have everything you need? Yeah, thanks. See you later.
Jewel beat.